to reposition the Nigerian Institute of Medical Research (NIMR) to do more in its role of providing modern treatment for diseases in the country. The management of the institute has signed a Memorandum of Understanding with the Federal Medical Center (FMC) Butemeta, Lagos, for collaboration on multidisciplinary health research and clinical trials. The event took place at the NIMR premises Yaba on Wednesday, the 9th of January 2019.
We as Medical Research Institute ideally should have a research hospital. But over the years that we have grown, we have only been able to create a research clinic. But sometimes you need to admit patients for observation during research, especially in relation to some drug trials. Or sometimes when you go to the field, you pick up patients with certain diseases that you want to investigate further in terms of research. You need a place to keep them. We don't have that. We're only planning recently to have an observation room, but the observation room will not even be enough for us. So we think to be effective in our mandate, we should approach the Federal Medical Center to use their facility as our research hospital, so that when we work together, we can always get our human participant from the hospital. And if we go to the field and we have people who want to observe, we can always take them to that hospital.
The initiative, according to stakeholders, will provide opportunity for better approach to disease management and drug development.
Well, the message to the public is to say that they should be ready to participate in research, because all the drugs they are using today are all products of research, and we continue to need newer drugs, better, more effective agents to treat diseases, and they can only be tested among those who will use them, which are human. That there is no need to be afraid of taking part in research, because their interests have always been taken care of by the process of Institutional Review Board.
It is never compulsory for a patient to be part of a research, and no patient will be put at a disadvantage either in terms of the cost of care or indeed in terms of the services that we render to the patient as a result of a participation or non-participation in a research process. The good thing is that NIMR has been at the forefront of research in this country, particularly medical research. We are a service delivery institution essentially. We are happy to be part of this process, and we know the basics, we know the principles, but we are even willing to learn more from NIMR. No single patient of Federal Medical Center Butemeta is going to suffer any disadvantage, either in terms of cost or in terms of service delivery, as a result of an acceptance to participate or a non-acceptance to participate.
Happening early in the new year, many are optimistic that this is a sign of better things to come for the Nigerian health sector in 2019. Gloria Danes, Insight TV Blog.